The summer that you used to feel 10 years back and the summer that you feel now is totally different.
It's becoming more intense, more frequent, more costly.
Extreme heat is not just a climate issue, it's a public health system challenge shaped by inequality.
I think about the police personnel on the street. I think about a construction worker. I think about the gig worker. Think about a smallholder woman farmer.
We call heat as a silent killer. Heat is impacting our lives and overall our health in a very different way compared to any other climatic hazard.
It is a question of livelihoods, it is a question of health, it is a question of day-to-day survival.
I would love to see a near future where no one has to be dying of heat.
Climatic conditions do not follow administrative boundaries. The temperature or number of hot days do not know whether they are happening in India or they are happening in Nepal.
The problem is so big that siloed solutions will no longer work.
The Global Heat Health Network in South Asia can help countries share knowledge, strengthen coordination, and scale proven heat solutions faster.
This kind of integrated approach, we believe, helps move from fragmented efforts to coordinated, scalable solutions.
And we've got to start by keeping people at the center and collaboration as the glue.
The GHIN South Asia Hub, which is being hosted at CEEW and it will operate in collaboration with various partners within the region, aims at working in India, Bangladesh, Bhutan and Nepal on 4 thematic working group: heat and health, heat at work, heat and cooling, and heat and governance.
We're very happy for the proposal that was put together, led by CEEW, with partners including NRDC, Sustainable Futures Collaborative, UNESCAP and BRAC. For us, it's very important to partner with reputable institutions that are well known locally, maybe nationally or regionally, or even globally. Those decision makers and stakeholders do pay attention because they trust that person, they know the institution.
You have expertise in policy and governance, expertise in finance, expertise in community-based work, expertise in international convergence and integration of policies. You have expertise in health research and various other related fields that I think the plurality of this work really foregrounds how integrated we need to be thinking about heat going forward. And that means looking beyond short-term response and really thinking hard about what building long-term resilience means.
So right now we have 300 heat action plans. There are another 100 that are in making. There is a person behind each of these heat action plans, and it's very, very important that the hub provide orientation to a whole lot of administrators, policymakers who have not been able to recognize all the dimensions of heat wave management.
The hub can support countries to turn evidence into practical policies and strengthen early warning systems, as well as integrate heat into disaster and climate planning.
Having the capacity to be able to share our knowledge, to be able to generate knowledge, and to be able to influence policy, direct finance, and to be able to influence the outcomes. I think that's what's going to be the beauty of this.
We believe that no one should die of extreme heat, that people are aware, that governments are prepared, that decision makers are hearing what universities and researchers are finding out, different sectors and institutions are working together, that those very vulnerable populations, the informal workers, economy, or the children or the elderly are part of these conversations.
From a UN perspective, success really means that countries moving from reacting to heat emergencies to anticipating and managing heat risk.
So 5 years from now, I think extreme heat would have become a much more visible problem. And we will not be calling it invisible hazard or invisible killer anymore. We will have more significant scientific evidence that would have put on the table of decision makers to bring policy interventions to address this issue. It is time now to use this research to act faster together.
We very much look forward to contributing to this collective effort meaningfully and build heat-resilient communities across South Asia.
The opportunity that we have here with the Global Heat Health Information Network and its South Asia Hub is that we take that crisis and confront it head on, that we build resilience collectively, that we demonstrate to the world that we are not just talking, we're not just asking, we're doing.